our results imply that when you look at how NfL is related to this underlying pathology in earlier stages, we see that at least on MRI measurements, NfL is predominantly linked to axonal rather than neuronal damage, and it is already able to capture changes in cognitive performance prior to onset of clinical symptoms. NfL is a valuable biomarker because it can measure non-invasively these differences in cognitive performance, but also already axonal damage. And maybe it can be used to monitor severity of disease in this earlier stage in a population without a clinical diagnosis. And in the slide, it might also be used as a sort of disease monitor, biomarker, or a marker of treatment response. So when you look in an early intervention study and you administer, for example, anti-amyloid treatment, you can monitor if NfL values improve or not. So in that sense, it can also be a treatment biomarker. And I think for future studies, it would be nice to also look at changes in NfL values. So now we only looked at baseline NfL values, but also look at how these values change over time and how that is related to brain pathology and cognitive functioning. And maybe we can also see how it is related to other blood biomarkers for Alzheimer's disease, including new biomarkers such as p-tau 181.